each of our bodies, we have about 100 trillion cells that are working in harmony to make us function normally and also to keep us alive. But sometimes a few cells out of these 100 trillion cells, it is possible for them to go wild, or in other words, to act in an unnatural way. And cancer is one such instance. So let's see what happens in cancer. If you study the nature of cancer, you can understand this fact. There are few features of cancer which we call as hallmarks of cancer. To name a few, one is it evades apoptosis. So apoptosis is a process where naturally there will be a cycle in a cell and natural cell death will occur. But this does not happen in a cancer cell, so they are kind of immortal in a way. And the cancer cells are self-sufficient in growth signals. They can make their own growth signals to grow. And also they don't obey the natural anti-growth signals. Right? So whereas any other cell, when there is an anti-growth signal, it will obey and stop growing, but cancer cells does not obey that. It reprograms their energy metabolism. Right? A cancer cell would not metabolize sugar in the same way that a normal cell would do. And there are other things like it will evade the immune system, and also there's a process called sustained angiogenesis where it makes its own blood vessels. So you can see it is not really helping this natural order of the body. It's acting in a weird way, not really helping this harmony of the other 100 trillion cells. So what causes that to happen? Now let's talk about how this could happen. What are the causes? If you reflect about your life, how natural do you think it is? Now let's take one by one. If you talk about food, for example, how natural the food that you consume? Is it close to nature or is it far from nature? If you take meat, for example, now meat that is grown in farms is one of the most unnatural things that you can find. Right? Usually the animals are caged in small cages and overfed, and so they are not really like walking as normal animals. So it grows in an exponential rate because the consumption is high. So this meat is very unnatural compared to a natural healthy animal. Even vegetables or fruits, if you see, some of them are genetically modified and some of them are bred by using heavy pesticides. So it is also not natural in a way. And then if you think about your lifestyle, right, how you live your life. Now usually we are beings who are supposed to follow these rhythms of nature, of the sun and the moon. Right? So we wake up with the sun, and usually after sun sets, and there will be darkness and we are supposed to go to sleep. But we have changed our lives. Right? Some people work the whole night, which deviates. Now there are interesting studies about this, even how plants act. For example, there's a plant called mimosa. This was one of the first studies about these circadian rhythms by a French scientist who studied that he took a mimosa plant, Mimosa pudica, which reacts to the light, right? So when there's sunlight, it will open up its leaves, and then as sun sets, with the darkness, it will kind of flex, right, these leaves, and go to kind of a sleeping. So what he did was, he took this plant to a lab, and he tried by giving some artificial light into it through a bulb, right, to see if it changes. It did not. They expected it would, but it did not do that. It slept. So which means this is some kind of an something that is coming from inside, something that is coming from far, that is tuned with nature. Right? And whereas when you try to change it with a stimuli from outside, it is something not in tune, not natural to that. So we do that a lot these days, right? So with food and with our lifestyle. So then, I mean, if you take a human, it's made up of 100 trillion cells, and each of it is working in harmony. So if the whole being is working in an unnatural way, then it's possible for some 1 or 2 cells to act in an unnatural way. So this is how it happens. Being away from nature, deviating from nature, which causes some cells to go wild and to act in an unnatural way. So this causes all these hallmarks which we talked earlier. Right. So but when this goes out of balance, what can we do? What can we do to correct that? So let's look at a bit of a holistic approach on how we can achieve the balance again, right? Which is the only way to treat it, right? Or to cure it. So first thing would be to come away from all those unnatural things to a natural environment, right? Because if you stay in the same unnatural environment, doing unnatural things, then how can you make your cells to act naturally? So the first point is you get away from that unnatural thing. We call this, now in Ayurveda, any illness, the causative factor is called Nidana, right? The causative factor. So Nidana Parivarjana is the first step, or in other words, breaking that, that causative factor, coming away from that. Right? So let's say you have come away from that causative factor to a more natural lifestyle, to a more natural environment. And then what can you do to restore the balance of the body? Because there's a huge imbalance in this. Now, most of the time what happens is, now in a cancer, usually in conventional medicine, they tend to focus on this, on the lesion itself, So, which you can see by some imaging studies with MRI or other scanning methods. You can see this lesion, which is of course doing some harm to the body, but it's not easy to see the imbalance that has caused as a whole. So, but this imbalance is in the first place, it is the cause that has caused this to manifest. Right? So instead of removing this lesion, either with radiotherapy or with surgery or with chemotherapy, it's important to create a balance in the whole individual if you really want to get rid of it. And otherwise, if you just remove that, the result of the illness, whereas the causative, some of the imbalances are still there, then it could recur. That's why most of the cancers recur again and again. So, so let's look at how Ayurveda, how these indigenous systems of medicine handle this. First step is, you try to eliminate these toxins, so whatever that is accumulated in your system, because which will be feeding for the cells to mutate even more, for the genetics to go mutate even more. So you have to take it away from the body. So we incorporate a lot of cleaning process, which we call collectively as panchakarma. We do clean your body. We drain your sinuses, and you drain your the whole gut, through vireka. And there are a lot of other systems where you clean the body, right, to eliminate all these factors which are not needed in the body, which in a way helps the body to regain its balance, right, through homeostasis. And meanwhile, you try to improve those little inaccuracies that has caused by this systemic illness. For example, you would improve the patient's digestion, right? Because according to Ayurveda, digestion is one of the key factors, for health. And most of you know that in cancer, many patients, they lose their appetite and they lose their weight as a consequence because they are not absorbing the food they eat, right? And also, the cancer is also, absorbing some of the nutrients that you consume. So, so improving digestion can tackle most of these challenges, right? Because it improves the appetite as well. And then enhancing the immune system, or in other words, modulating the immune system. This is something that we do in Ayurveda because Susrucha Acharya says that the immunity and the strength of a patient has to be maintained always, as it reduces the intensity of the illness. For example, if your immunity and the strength is higher, then the intensity of the illness, you don't feel it much, right? Whereas if your immune system goes lower, the effect of the illness will be overwhelming the body, right? So, and this is especially mentioned in the Granthi Arbula Chikitsa Adhyaya of Sushruta Samhita, which is the chapter that is dealing with cancer therapeutics in Ayurveda, which is written about in 600 BC. So, so there are several formulations, and also even food and other single herbs which improves your immunity. To name a few, there is amla, Indian gooseberry, and then guduchi, which is Tinospora fordifolium, and even other natural rice varieties. Like there are some brown rice varieties which are indigenous, to some countries. So these can naturally enhance your immune system to make you more stronger. So that which will create some kind of an resistance from inside the body towards the cancer, right? So it can't. It's difficult for that to grow when there's some kind of a resistance from inside. Right? And this is now actually being done even in Western medicine as well. So because most of the new novel drugs that are coming to the market, they are more they are working more on immune checkpoints rather than the traditional chemotherapy. And then there are other things like there are specific treatments based on where the cancer is, right? Whether it's in your brain or whether it's in your gut, right? Because some of the entities, some of the clinical entities that are mentioned in this classical text, right? They mentioned about Sannipataja avastha, or in other words, where all three doshas come together, right? They often correlates with certain cancers, right? So you can use the Chikitsa Sutra, or the therapeutic regimen that is indicated in such instances, right? And apart from these, there are also medicines which works directly on the cancer cells itself, right? In Indian medicine, I'm also in Sri Lankan Indigenous medicine, which is rich in herbal mineral medicines. We call this Rasa Shastra, or in other words, you can call it alchemy, right? Sri Lankan or Indian alchemy, where you process natural minerals, right, taken from earth, and you mix it with herbs to make herbal mineral compounds, and this is administered in small doses, which possess very high and very potent anti-cancer properties, right, which can combat the cancer cells, just like chemo drugs do. So you see the approach. It's a bit more holistic. It works on the whole organism, right? As a first step, you bring this person to a more natural environment, right? Because being in an unnatural environment is supporting the cancer, right? So and then you start treating the person with these herbs, and also yoga, meditation. These things also complement, because they also help this to regain this lost balance, right? To restore the balance of the body. And so as a whole, you're working in all the factors that cancer is deteriorating, cancer is deranging in the body, the mind, body, and even the soul. So this is pretty much what we do in Plantation Villa. Our environment, if you look at it, it's set up in a very natural, it's inside almost like a 14-acre forest, and there's abundance of nature and wildlife. So this will call out to your genes, because they remember that you are a natural being. You are supposed to be in this nature, right? And that will create, just being inside this nature will create a vibe that will help, that will start the healing process by itself. And then meanwhile we administer the herbs daily, and also the herbal massages, which is also helping to detox your body, and other panchakarma, which is cleaning your body, and herbs to strengthen. Every day you are given these herbs, and a doctor will be, we have a team of doctors who will be assisting your health to monitor, because each cancer patient is different. Now there can be two patients can have the same cancer, but the treatment that we give, the way we administer the treatment could be different in each case. This is something unique to Ayurveda. We do what is called Rogi Pariksha. You assess the illness, and then you assess the person having the illness. So one person could be having the illness in a certain illness, but the conditions could be different from another person who is having the same illness. So you consider all these things and then administer herbs accordingly. So which is very, very personalized. Or in other words, it's very, you can say it's this is now called as even precision medicine, right? In Western medicine, because they do it by doing some genetic analysis, but we do it by doing what we call as Dasharida Pariksha. You check different parameters of the person to understand him or her well, right? So that, and then you modulate the treatment accordingly. So all in all, if you look at this, there are a few things that you need to be aware, right? So think about your life now and see whether your lifestyle is natural, right? Whether the food you consume is natural. If not, it's time to make a change before it's too late, because it's always better to prevent something, right, than to treat it when you have it. So if you are living an unnatural life, try to be in touch with nature. At least once in a week, try to sit under a tree, and maybe you can go to a park or try to walk barefoot on the grass. And also look at yourself and see whether you are in tune with yourself, whether you are really one with yourself, or you are running after, or whether you have tangled in a rat race. So think about it and try to come in tune with yourself. You can use yoga or meditation, to come in tune with yourself, which will collectively help this harmony of the cells, that 100 trillion cells are working. And also think about the food that you eat, whether it's natural or whether it's unnatural. So try to consume things that are as close to nature as possible. Right? If you are consuming more unnatural things, that will cause your system, to go wild. So try to get away from those unnatural things as much as possible and try to consume things which are more closer to nature. So if you do these things, it's possible to stay away from cancer, because it has become a huge burden to the world. Just if you consider the last year, there has been about 18 million cases, newly diagnosed cases, and about half of that number has died within the last year. So it has become a huge burden, and if you shift towards a more natural lifestyle, you can help to ease that burden from the world, and also you can live a more natural and more happy and a healthy life. Thank you. So the question is that how I would take this approach, into the Western world, because it's much less known in the West, and also whether you can collaborate, whether you can do this as something to complement those therapies, right? So I will start with the second question. Yes, it is possible to do this together, right? Sometimes, because I told several modalities of treatment, like the improving immune system and this elimination. So these processes you can actually do along with some of the Western medication, to enhance the immune system, because that will improve the quality of life, right? Which is one of the challenges in some chemotherapeutic drugs, because it can heal the illness, but it tends to deteriorate the quality of life of the patient. But this has to be worked carefully, because some doctors say that yes, that these natural agents, it can interact, with this chemotherapeutic drug. So you have to have a good understanding of both, when you are prescribed. But there are some patients who opt to do that. And how to take this to the West? Yes, so we try to follow these cases. Usually we would follow these cases for, now the treatment itself can take about a year, I would say. It can range from 6 to 8 months up to 18 months, I would say, right? Because this is an imbalance that is caused over a long period of time, so it will take naturally a long time to restore the full balance of the body. And even afterwards, we follow these cases, every 3 months or so, we do the imaging studies, and then some of these has been published, and we have also presented some of these in the World Cancer Congress in 2016, where you can see some of these how we have tackled with Ayurveda, and there has been some integrated cases also, where we have both approaches from Western medicine. Sometimes you do the surgery, and the rest is handled with Ayurveda. So this integrated approach is also presented in some of the conferences. So the question is the correlation between meat and cancer. It's a good question, because there's Now even the World Health Organization, they say that someone who is consuming red meat or processed meat is susceptible to get colon cancer, which is even higher than someone getting lung cancer by smoking. Right? Actually, this fact has been mentioned in Sushruta Samhita, which is written thousands of years ago. It says that persons who consume meat excessively or too much tends to get cancer more. Right? And nowadays, I would say it will cause even more and more, because the meat is unnatural. Right? Because we described about this, how the animals are being bred. So for this reason, it's good to leave meat off your plates.
How is it when like very young people have cancer, so they haven't lived that long to maybe be that much out of balance? Yes,
it's a good question. So so the question is how come that babies or even very young people get cancer? Because now what we talked about is that you are exposed to some unnatural stimuli over a long period of time, which will cause the cells to go unnatural. Well, there are two reasons. One is, even when you are inside the womb, right, of the mother, if the mother acts in is having a very unnatural lifestyle, that can predispose to cancer. Right? So this is one reason. And the other reason is of karmic origin. And this is also described in Ayurveda, where some skin diseases and some of these illnesses like cancer, they especially mention, has an origin which goes beyond your birth, right? Which is some kind of a bad act that you may have done, which has, so as a consequence of that, this is happened to you, right? Because so this is one of the ways how you can explain it. Otherwise, there's no explanation to to say how a very because some babies they have cancer in a very, very young age. So the question is, what is the difference between the approach from Ayurveda, which is, I would say, of mainly Indian origin, and indigenous Sri Lankan medicine? So I would say there are a lot of similarities, right, in the concepts. But there are some differences in the choice of medicines and treatments. One of the differences is like there are a lot of herbal mineral compounds or rasa drugs, we can say, which is not used in Indian Ayurveda, which we use here. And also there are some plants that are used according to the area we live. Right? Because I would say Indian Ayurveda and Chinese traditional medicine, Tibetan medicine in Tibet, and Sri Lankan indigenous medicine, all these have some kind of a common root, but the choice of medicines that they use is different. Right? So I would say in Sri Lanka it's very rich in these formulas. Right? Most of our these manuscripts, palm leaf manuscripts that are written many thousands of years ago, contain a lot of formulas, a lot of prescriptions which can be used for cancer. Whereas if you look at the texts in Ayurveda, they mostly outline the concepts that you should utilize, in treating the cancer. But again, even in India, there's this indigenous system that they have in India. So they also use these different prescriptions, which is slightly different from what is written in the texts, from Charaka Samhita or Sushruta Samhita. And apart from that, in Sri Lanka we use there is a lot of cultural aspect as well, because Sri Lankan indigenous medicine is more bound with Buddhism. So there's a lot of chanting. Like even when we prepare a medicine, we chant a lot of what we call as spirit or the sutras in Buddhism, which is actually chanted out of metta, out of love towards the patient whom we are going to give this medicine. Right? So I remember my guru saying that when I was with him learning how to prepare these medicines. So he teaches about the ingredients, which you are putting in exact amounts, and he said the most important ingredient that you should add is love. Right? So usually, if you are not, if you are angry or if you are not in your mind, he doesn't even allow us to come when he prepares medicine. He says, "Go meditate and you come back." So it's important because this is shown in now with in the Western world, what you call but through quantum mechanics. The observer has an effect on the on these little particles. So which means what you think actually matters. Right? So we use this a lot in Sri Lankan indigenous medicine, because even before you take a bark out of a tree, you bow the tree and you take permission from the earth, because Mother is the owner of this tree. Right? So you take permission and then you bow the tree. You take this bark or these leaves, from the specific site that is mentioned, and then there are several measures that you do to the tree. For example, if you take the bark, then you will take some earth and you apply it on the place where the bark was taken, so that it will protect, the tree from getting some bacterial infection. So it's very, very humane and a very loving approach. I think this approach from Buddhism, is much embedded into this Sri Lankan indigenous system. So all these, most of these herbs, especially these herbal mineral ones and these special herbs, are chanted over and over while throughout the preparation. Right? And some of the oils which are prepared over long period of time, over many days on a very low flame, are also chanted until the oil is until it is finished prepared. And also it says that while preparing some of these herbs, some of these special herbs, you have to stay vegan. Even the one who prepares has to stay vegetarian, without consuming meat, and he has to take a shower with this turmeric or special things, and also have a good mindset before you start the preparation. So a lot of these subtle things are there that I find in Sri Lankan indigenous medicine, which will fortify the medicine so that it works much better in a patient. So the question is, what is the prognosis or the success rate of these treatments that we do with Ayurveda in different stages? Yes, obviously it is easier in earlier stages, right? And in later stages, especially when most of the vital organs are affected, the prognosis will be quite poor, because it's difficult for the body to retain the balance. When a lot of major organs are affected at the same time, like when you have reached stage 3 or 4. And but even in such instances, we still offer treatments. Like, although we might not be able to cure it, but still you can try to improve the quality of life. You try to reduce those little discomforts, or these discomforts that the patient is having, and try to make the rest of that patient's life to ease up a little bit with some Ayurveda treatment. It is possible. And also it depends on the type of cancer as well. I'd say some type of cancers are difficult, like for example bone cancers, like chondrosarcomas or osteosarcomas, which happens mostly in young adults. This is something very difficult in Ayurveda, and Ayurveda also tells the reason for that. We talk about these 7 tissue levels, or which we call as Sapta Dhatu. So Hasti Dhatu, or the bone tissue, is one of the deeper seated tissues in the body. So when it goes deeper and deeper, the treatment becomes difficult. And then in other cancers, like for example in the cancers in the digestive tract, again it depends on where the cancer is. For example, if it is usually in the esophagus, whether in the upper part or like in the gastroesophageal junction, usually it's a little bit difficult because the patient will have difficulties in swallowing food or even medicine, and so this is standing in the way of treatment. But there's the success rate of cancers that is in the lower GI tract is very high with us. We have a lot of recovered cases, and there are other cases like liver cancer, hepatocellular cancers, which is something quite difficult to manage in conventional medicine. But we have achieved success in some of that. I would say, like again in earlier stages, but even in some cases where they have reached like a stage quite difficult to reverse, like jaundice and with obstructive jaundice symptoms, we have been able to somewhat reverse some of that. Not always, so because liver cancer and pancreatic cancer especially, they can act very aggressively and invade the other organs. And we have achieved good success in uterine cancers as well, the cancers inside the womb. Yes, it varies. I mean, also it varies with the patient's strength and condition at the same time, and also depends on the other illnesses that the patient is having. For example, if the patient is diabetic, then the treatment becomes more difficult, right? But one thing I can say is like it's very difficult to predict. I mean, to say the prognosis of a cancer. I mean, we can take our experiences and also our database and say, okay, this is how we have done, but they can act in very weird ways.
And breast cancer?
Okay, breast cancer, yeah, I would say it's 50-50. I mean, we have achieved like great success over the last, actually in last 2 years. There has been many patients, with breast cancer who came here, and but quite in early stages actually. So with them, we are still following up, with the imaging studies and all of that, and most of them, they had opted out from the traditional treatments, and they wanted to do Ayurveda, and some of them had done the surgery, and but instead of going through chemotherapy and or radiation, they opted to do Ayurveda. So, and we are following up those cases, and there's a lot of success in that.
What about like patients who have the second time cancer? Do you treat them differently, or is there any difference than when they come and have it like the first time?
Okay. So the question is, what when the cancer recurs? When the patient is having cancer for the second time, maybe at the same place or metastasized to a different organ. So yes, still we can treat, and it will depend on patient case by case, because sometimes, let's say initially when the patient has got some chemotherapy or some kind of a surgery, has went through a major surgery, so in both these cases usually the immune system is compromised a little bit. So sometimes before we work on the cancer itself, we will have to work a bit on restoring the energy, the strength, or the immune system, and then we work on the cancer. So it's different. So the causes behind breast cancer, it's mostly hormonal of origin most of the time. So some of the contraceptive pills, some of the hormonal methods can predispose towards that. And also when you say about hormones, if you are emotionally disturbed, then of course all your hormones can get disturbed as well. And we have seen that when we go through the history of the patients, and when they tell their stories, some of them has some kind of a deep-seated some emotion that is stuck inside, which may have predisposed to this. And so we have to accommodate a way to let this out, to express, and to rather than to keep them inside. So by allowing a way, to express themselves and to practice meditation and yoga, in which they can understand that this emotion is something natural, that so through that understanding they can let go of that, right? So some kind of an approach is also important in treating breast cancer. So yoga and even this other herbal treatments which can restore the balance of hormones are also beneficial in such cancers. So the question is how your mentality affects the treatment, or whether you should, how does it react, like when a person has a more controlling nature and is fighting towards the cancer, or should you be accepting the facts and try to calm down yourself and come in tune with yourself. So I would say latter is the better approach, where you have to kind of accept it, but not to hold it, right? Not to hold it in your mind, because of course when you hear this diagnosis, it plants a seed in your mind, right? You are having this illness called cancer, which is usually incurable, right? So when that gets implanted in your mind, of course the treatment becomes difficult, right? So the best way is to get rid of, try not to think about it too much. So one of the things that we tell the patients is to now you can let go of the worry and try to do whatever you do, and we try to worry about how to treat you, right? So in a way you surrender, right? So, and through that you can relax, which helps the treatment, rather than, because some people, they act in a different way. They're in a more controlling nature. They even try to control this cancer itself, or try to fight with it. I would say, fighting, you should do something to, of course, overcome the problem. But if you create such a conflict, such a conflicting or such a mindset that where there is hatred and anger, that is not really helping the treatment. Right? Instead, if you just accept the fact, okay, there is some kind of cells has gone out of balance, and there's some imbalance in your system also, and I'm going to restore that. I'm going to restore that imbalance, try to balance myself. And then your physician will do what is necessary. That helps the treatment process more. Because there's a saying that Hippocrates, who is supposed to be the father of Western medicine, he says that some patients whose condition condition is perilous, whose condition is severe, they recover their health simply through their contentment with the goodness of the physician. Right? So it's important to trust, whoever your doctor is, and to kind of to allow to do what is needed, and you relax at the same time.